If you're over 65 and taking blood pressure medication, what I'm about to tell you could save your life. There's a common approach to treating high blood pressure that doctors have used for decades. Lower is better, right? Get those numbers down. But new research shows something shocking. A 2023 JAMA internal medicine study followed 12,000 adults over 65 for 7 years. Those whose blood pressure was aggressively lowered had 58% more falls, 34% higher kidney damage rates, and shockingly, no reduction in heart attacks or strokes. The mistake? Treating elderly patients with aggressive blood pressure targets designed for younger adults. It's causing silent damage to arteries, kidneys, and brain. One cardiologist calls it the 120/80 trap, and if you're over 65, this outdated target could be doing more harm than good. Today, what blood pressure should actually be after 65, why overtreatment is dangerous, and 5 warning signs your BP medication is damaging your body. Drop your age and current blood pressure in the comments. For decades, 120/80 has been called normal blood pressure. But here's what most don't realize. That number was established from studies of middle-aged adults, not seniors. After 65, your cardiovascular system changes. Arteries naturally stiffen. Your heart works harder to pump blood through less flexible vessels. Your kidneys become more sensitive to pressure fluctuations. Your brain's blood flow regulation changes. When doctors aggressively lower BP in older adults to hit 120/80 or lower, they create danger. Blood pressure that's too low can't adequately perfuse organs. Your brain doesn't get enough oxygen. Kidneys can't filter properly. The 2017 SPRINT trial suggested intensive control, below 120, was beneficial. But analysis of adults over 75 found the intensive group had significantly higher rates of acute kidney injury, electrolyte problems, falls, and fainting. Current American College of Cardiology guidelines now acknowledge this. For adults over 65, especially over 75, a systolic target of 130 to 140 is often more appropriate than aggressive 120. But many doctors haven't updated their practice. Many seniors are still being pushed to dangerously low numbers. Falls and orthostatic hypertension. Orthostatic hypertension means blood pressure drops dramatically when you stand. Your brain briefly doesn't get enough blood. You feel dizzy, lightheaded, or faint. A 2022 Hypertension journal study tracked 4,800 adults over 70 on BP medication. Those with systolic pressure consistently below 120 had 67% higher fall risk versus those at 130 to 140. Why? When medication lowers baseline pressure too much, your body can't quickly adjust when you change position. Stand from a chair. Pressure plummets before your system compensates. Result: dizziness, loss of balance, falls. Falls after 65 are catastrophic. Hip fractures, head injuries, loss of independence. 1/3 of seniors who break a hip never return to independent living. Warning signs: dizziness standing from sitting or lying. Lightheadedness after morning medication. Feeling unsteady during the day. Near fainting episodes. Needing to sit back down quickly. If you experience these, your BP target may be too aggressive. Kidney damage. Kidneys need adequate blood pressure to filter waste. They're designed for a specific pressure range. Too high damages through sheer force. Too low damages through inadequate blood flow. A 2021 American Journal of Kidney Diseases study followed 6,200 adults over 65 with stage 2 to 3 kidney disease. Those with BP below 120/70 showed accelerated kidney decline over 3 years versus those at 130-140/70-80. Your kidneys need certain pressure to push blood through filtering units called nephrons. When pressure drops too low, filtration decreases. Waste accumulates. Creatinine rises. Over time, this accelerates chronic kidney disease. Warning signs: rising creatinine on blood tests. Decreasing GFR, filtration rate. Leg or foot swelling. New fatigue after medication change. Foamy urine, protein leaking. Many doctors don't monitor kidney function closely enough during aggressive BP treatment. Request regular kidney function tests. Brain hypoperfusion. Your brain requires constant blood flow. It uses 20% of your body's oxygen despite being only 2% of body weight. When blood pressure drops too low, brain perfusion suffers. A 2020 study in neurology examined 3,400 adults over 70 with intensive BP control, below 120. After 4 years, they showed significantly faster cognitive decline and higher dementia rates versus those maintained at 130 to 140. The mechanism: reduced cerebral blood flow. Your brain compensates for years, but chronic underperfusion damages neurons, accelerates white matter disease, and impairs memory formation. Warning signs: brain fog or mental cloudiness, increased forgetfulness after medication changes, difficulty concentrating, feeling not quite right mentally, slower processing speed. This is called cerebral hypoperfusion. It's subtle, progressive, and often dismissed as normal aging. But it's often medication-induced and reversible. If cognitive symptoms appeared or worsened after BP medication adjustments, discuss with your doctor. Electrolyte imbalance. Many BP medications, especially diuretics, water pills, affect electrolyte balance. Aggressive treatment compounds this. Sodium, potassium, and magnesium can drop to dangerous levels. A 2023 study tracked 5,100 seniors on multiple BP medications. Those with systolic below 120 had 3.4 times higher rate of severe electrolyte disturbances requiring hospitalization. Low sodium causes confusion, weakness, seizures. Low potassium causes heart rhythm problems, muscle weakness, cramping. These can be life-threatening. Warning signs: muscle weakness or cramps, irregular heartbeat or palpitations, confusion or mental changes, severe fatigue, nausea or loss of appetite. Many doctors don't check electrolytes frequently during aggressive treatment. You should have these tested every 3 to 6 months minimum, more often with medication changes. Ask: when were my electrolytes last checked? Can we test them again? Medication polypharmacy cascade. This is the hidden danger. Aggressive BP treatment often requires multiple medications. Each adds side effects. Side effects get treated with more medications. You end up on the 8th of October drugs, each interacting with others. A 2022 geriatric medicine study found seniors on 3+ BP medications had 89% higher risk of adverse drug events versus those on the 1st of February medications, even when achieving the same BP numbers. The cascade. Diuretic causes low potassium supplement prescribed causes stomach upset. Antacid prescribed interferes with other medications. Adjustments needed more side effects, more medications. Warning signs: taking 5+ medications. New symptoms after each medication addition. Medications to treat medication side effects. Difficulty remembering medication schedule. Frequent dose adjustments. More medications aren't always better. Often, lifestyle changes plus 1 or 2 well-chosen medications work better than 5 drugs at high doses. What BP should actually be after 65? Current evidence-based guidelines for adults over 65. Ages 65 to 80, generally healthy. Target: 130 to 140 systolic, 70 to 80 diastolic. Acceptable range: 125 to 145 systolic. Ages 80+, or multiple health conditions. Target: 135 to 145 systolic, 70 to 85 diastolic. Individualized based on frailty, falls history, kidney function. Key principle: treat the patient, not the number. The American Geriatric Society recommends considering: fall risk, history of falls, prioritize higher BP, kidney function, declining GFR, avoid aggressive lowering, cognitive status, dementia risk, maintain higher perfusion, functional status, frail, higher target safer, life expectancy, limited, comfort over aggressive control. A 2023 review in Journal of the American Geriatric Society concluded, for most adults over 75, systolic BP of 130 to 140 provides optimal balance between cardiovascular protection and safety. Your BP target should be personalized, not based on a one-size-fits-all number established for 45-year-olds. If you're over 65 on BP medication, have this conversation. 1. Is my current BP target appropriate for my age? Many doctors still use outdated aggressive targets. 2. Have you checked my kidney function recently? GFR and creatinine should be monitored every 6 months minimum. 3. Could my dizziness, fatigue, brain fog be from low BP? Doctors often miss medication-induced symptoms. 4. Can we try fewer medications at optimized doses? Sometimes reducing medication complexity improves outcomes. 5. What's my blood pressure when I'm standing versus sitting? Orthostatic BP should be checked regularly in seniors. Bring a list of symptoms that started or worsened after medication changes. Bring recent BP readings from home. Be specific about falls, dizziness, or cognitive changes. Good doctors welcome these questions. They want you as an informed partner. Before adding more medications, optimize these factors that significantly impact BP. Sodium intake. Moderate reduction, 2,300 milligrams daily, helps most. Extreme restriction, under 1,500 milligrams, can be harmful in seniors. Potassium-rich foods. Bananas, sweet potatoes, spinach, avocados. Often more effective than medication adjustments. Stress management. Chronic stress raises BP 10 to 20 points. Deep breathing, meditation, gentle yoga help. Sleep quality. Poor sleep raises BP significantly. Address sleep apnea if present. Gentle daily movement. Walking 20 to 30 minutes daily lowers BP 5 to 10 points. More effective than aggressive medication in some studies. Weight management. Even 5 to 10 pounds loss can reduce BP medication needs. A 2023 study found seniors who optimized these factors reduced BP medication needs by 40% while maintaining safer BP ranges, 130 to 140, versus aggressive medication alone. Here's the truth about blood pressure after 65. The aggressive targets designed for younger adults may be hurting more than helping. The goal isn't to get the lowest number possible. It's to find the optimal balance that protects your heart without damaging your kidneys, increasing fall risk, or impairing brain function. If you're experiencing dizziness, falls, fatigue, or cognitive changes after BP medication adjustments, don't dismiss them as just aging. These could be warning signs of overtreatment. Your action steps. Know your current BP and target. Ask if your target is age-appropriate. Request kidney function and electrolyte testing. Report all symptoms to your doctor. Optimize lifestyle factors before adding medications. The 1-20-80 trap is real. But now you know how to avoid it. Comment below. What's your current BP target? Have you experienced any of these warning signs? Share your experience. If this changed how you think about BP treatment, share it with someone over 65 who needs this information. Thanks for watching. Take control of your blood pressure treatment safely.